Hello, everyone. Thank you for joining us today for today's webinar. My name is Gary Smith, and I direct the Center for Injury Research and Policy in Columbus, Ohio. I'm a pediatric emergency medicine physician and a child injury prevention researcher and advocate, and I will be moderating today's webinar. The webinar today is brought to you by Trainees for Child Injury Prevention and also by Prevent Child Injury. So first, a little bit about Trainees for Child Injury Prevention. We also affectionately called that program the T4CIP program. T4CIP is a group of trainees, including medical students, residents, and fellows from across the U.S. Who are committed to the prevention of injury and violence to children and adolescents. T4CIP develops and implements outreach materials and strategies for one-day national advocacy campaigns, and today is our Button Battery Safety Day of Action. T4CIP is sponsored by the Center for Injury Research and Policy in Columbus, Ohio, and the American Academy of Pediatrics, and specifically by the Academy's section on pediatric trainees and the Council on Injury, Violence, and Poison Prevention. You can follow T4CIP on Instagram, X, and LinkedIn, or you can go to the website at t4cip.org. The second sponsor of today's webinar is Prevent Child Injury, which is a national group of organizations and individuals, including researchers, health professionals, educators, and child advocates, working together to prevent injuries and violence to children and to adolescents. Prevent Child Injury promotes coordinated communication to the public about child injury prevention through outreach materials and resources, the most recent one being about button battery safety. And to become a member of Prevent Child Injury, and membership is free, or for more information about child safety advocacy, please go to preventchildinjury.org or click the link in the chat. Just a comment that today, this webinar will be recorded, and a recording will be available, and a link will be sent by email to all those who registered following the webinar. And now to introduce our panel, I'm thrilled to tell you that we have three outstanding panelists with us today, and they will introduce themselves and make some introductory comments, and that will be followed by a question and answer period. Please put your questions into the chat. And we will get to them as we get to the end of the program. The first panelist will be Trista Hamsmith, who's with Reese's Purpose. Second will be Chris Chatana. He's a pediatric otolaryngologist at Nationwide Children's in Columbus, Ohio. And then Jonathan Midget, who's the Consumer Ombudsman for the U.S. Consumer Product Safety Commission. So Trista, let me turn things over to you.
Thank you, Gary. I'm happy to be here. I got involved with button battery safety almost 5 years ago now. It started when my daughter Reese swallowed a button battery. She was 16 months old at the time. Um, Woke up one morning and she was sick, snotty, stuffy, just not her usual self. And we took her to the pediatrician, and she was diagnosed with croup, which is a common misdiagnosis for button battery ingestion. We gave her a steroid shot. We were sent home, and it was the following day that we realized there was a button battery missing in our home. At that point, we rushed to the ER and had emergency surgery, and it was followed by a 2-month fight for her life. She endured countless surgeries, scopes, all of the things. When a child ingests a button battery, it starts to burn a hole within 2 hours. And in Reese's case, it burned a hole through her esophagus and through her trachea, and it created a fistula. She fought hard. The doctors fought hard. We all fought hard. Um, Ultimately, in December of 2020, she passed away. When I was in the hospital, I did a lot of research and realized that this wasn't just a freak accident. It wasn't a me problem. It wasn't a my house problem. It was a real problem, and a problem that's affecting a lot of families across the world. And so I decided that we were going to do something about it. And of course, I imagined that being with Reese by my side. Um, After she passed, I had some moms call me and say, "Hey, we want to do something. We want to help. What can we do? You want to park?" And I said, "No, I want change. I don't want other families to know what I know. I want a law." And so we started a journey and we ended up at the CPSC, highlighting Reese's story, asking for help from them. And they, of course, said, yes, this has to be a change. But, this could be done faster if you go get legislation. And it's like, sure, let me hop right on that. I knew nothing about politics. And with the guidance and help from the CPSC and so many other supporters along the way, like Dr. Chitana, we went to DC and we fought hard to get Reese's Law, which is legislation that requires that batteries in all products, not just toys, are secured, that there's stronger warning labels, and that batteries are now in secure packaging and that they can't just come in the flimsy cardboard that we could get them from. That law went into effect this last year. And of course, there's been growing pains with it, but it's wonderful to know that we're not going to hear of the stories and we're not going to know the kids' lives that were saved from it, but we do know for a fact they're out there. We're at a point now that education is so important and we have to keep speaking, we have to keep talking, we have to keep educating. Um, if we don't, there's going to be so many more families like mine that didn't know that that button battery in that remote could actually kill our kid. So through the nonprofit that I started, that's what we do. We speak. We speak loud, we educate, we fight for changes, we fund medical devices, we work with battery companies, and quite frankly, we get on fire about child safety, which is where I'm at in my life. If we don't educate, if we don't talk, if we don't fight for the future for our children that are out there, what's next? So I continue to talk and I continue to speak so that we can teach and educate others. Reese's life was important. Reese's life has a purpose, and that purpose is me speaking now. That purpose is saving others. That purpose is that if we can all get out there and educate others and tell others about the harms and the dangers, maybe there won't be another Reese one day. Thank you.
Thank you, Trista, and thank you for sharing your story. This is why we're here today, to prevent more of these from happening. Um, let's go to our next speaker, Chris Chitana.
Thank you, Gary, and thank you, Trista, for sharing your story and being here today to help educate our next generation of trainees on ways that they can become advocates. And I think I'm a pediatric ear, nose, and throat surgeon at Nationwide Children's in Columbus, Ohio. I've been in practice for 15 years, and I've been working on this problem for 15 years. And this is something that came across my mind when I was actually in training, like many of you who are on this webinar today. I saw numerous button battery injuries within the nasal cavity, ear canal, esophagus, when I was a resident in training, and they were devastating injuries. When I went to do my fellowship in Chicago back in 2010, about 15 years ago, I cared for a 2-year-old child who had ingested a 20 millimeter 3-volt lithium button battery and developed bilateral vocal cord paralysis. And this was an otherwise healthy child whose life had changed and couldn't walk across the room without getting short of breath. And I felt having to put a tracheostomy tube in a child to be able to breathe, got me thinking on how can we help prevent these injuries. And my journey of advocacy started when I was a fellow. When I put a tracheostomy tube in a 2-year-old child, and what can I do to try to change this going forward? Uh, Myself and Dr. Toby Lidovitz from the National Capital Poison Center presented in 2011 at the Consumer Product Safety Commission, and Jonathan Midget, who's with us today, was actually part of that group at the CPSC at the time. And at that time, things that we could do to increase awareness of the hazard. There was the Button Cell Battery Safety Act of 2011 that was introduced into the Senate in 2011 and just failed to get traction at that time. Despite our efforts of going to Capitol Hill and meeting with legislators, it was just deemed not to be a priority at that time. And from there, I focused my efforts and time on just ways that we can educate the consumers, the public, parents, caregivers on the severity of this hazard and ways that we can help prevent ingestions and insertions into the nasal cavity or ear canal and just overall awareness. And we focused efforts with collaboration with our industry colleagues, and so ways that we can talk to all stakeholders that are involved and try to figure out ways that we can work together to promote safety around these types of product injuries. And working with the UL group, coming up with voluntary standards was something we focused on back in 2014, 2015, trying to come up with ways that we could reduce access to battery compartments as well as access from battery packaging for children, standardizing warning labels. One of the things that I thought was interesting to look into, almost 10 years ago was how do we figure out the mechanism of injury, of how the battery actually causes injury within the body? And there was a lot of theories as to how that happens, and we were able to demonstrate the alkaline caustic injury that's powered by the battery that essentially burns a hole through the esophagus very rapidly, and within 2 hours, serious injury can occur. And knowing that mechanism and knowing that it's related to that highly alkaline caustic injury, what are ways that we can do with a severe hazard like this to help mitigate that injury after an ingestion? So could we come up with a first aid solution? And that's where we started thinking, what could we do to neutralize a highly alkaline injury? And we had to do a lot of studies to show that exothermic thermal burns do not occur when you neutralize a highly alkaline strong base like it does in the chemistry class, experiment in a beaker. And the body is 70% water. It absorbs heat. We found through our research that thermal injury actually does not occur when you neutralize a strong base with a weak acid. And that's where we came up with ideas such as the honey that's used as a mitigation strategy to help reduce the rate of injury once a battery is lodged in the esophagus. That's how we came up with the 0.25% sterile acetic acid that we use after we remove the battery in the operating room from a child to try to reduce the injury progression after removal of the battery. These are all just sort of novel ideas that we had because we understood the mechanism and because we understood that neutralization can be used as a mitigation strategy. So we focused a lot of efforts on research and ways that we can change the management of battery ingestions from a medical perspective and try to reduce the rate of injury, knowing that the clock is ticking from the moment that battery lodges in the esophagus. And from there, just ways that we could track quality improvement at the hospital level with expediting care as emergent cases, ways that we can measure nationally compliance with the standard protocols of doing the irrigation after removal of the battery, for example, and working with partners like Reese's Purpose and Trista's team to collaborate and find ways that we can accomplish goals together. And Trista is just one of those unique people that you meet in life that really is able to accomplish things at a much faster rate than most people, and to get a law passed in record time, with Trista's voice and that was something that we couldn't do back in 2011 when there wasn't the same scenario. And I think just ways that we can continue to push forward with what we really need. And And what we really need is a safe battery. And I think that's, the future of this hazard is how do we have a battery that doesn't cause severe injury when it's lodged in the esophagus. Interestingly, I remember being at the table with Jonathan Midget back in 2011, and one of the ideas he had was if only we shaped the battery like a pill, the pill wouldn't get stuck in the esophagus and the pill wouldn't cause injury. But, that involves changing the shape of the battery. That involves, backwards compatibility of all the electronic products out there. And, obviously, it's a idea that could work if we made all those changes. And I think, we're at the point where there's three technologies that are being developed around the world that are safe battery technologies that we want it to be like a coin that gets lodged in the esophagus. Kids swallow coins and they get stuck and they go home. Kids swallow batteries and they don't always go home. And I think just ways that we can just reduce this hazard by making the battery safe is the future. And I think just some general advice for all of you trainees out there, and just having been a trainee who really started to focus on advocacy while I was a fellow, I think it's really important to look for opportunities you can make a difference beyond the walls of the hospital. And I think it's really important as well to just look at what others have done on that topic and try to come up with new perspectives, ask new questions, seek new answers. If we were stuck with, the thermal injury that was caused by the neutralization of a caustic injury like an alkaline burn, we would have never come up with new strategies such as the honey, the sucralfate, and the 0.25% acetic acid irrigation. And I think collaboration is really important. None of us can accomplish these things alone, and really have to work in teams. And I think just coming up with ways that you can get the important data that may or may not be available on topics that you want to advocate for, because that data is really important to drive change. And I think just innovation is really important to keep in mind as well as a tool that can be used for addressing different types of hazards that affect children. And I think it's really important to not accept failure and to be persistent, and ways that advocacy isn't always going to be successful every time you go out there and try to do something. But I think if you look at new approaches and just ways you can collaborate and work together, I think you'll ultimately find ways to be successful. But being persistent is really important. So look forward to answering any questions during the panel.
Thank you, Chris. I really appreciate those comments. Jonathan, have you go ahead and take over.
Well, thanks. I'm Jonathan Midget. I'm at the U.S. Consumer Product Safety Commission in Bethesda, Maryland, and I'm currently the Consumer Ombudsman at the CPSC. In previous roles here at the agency, I was in the Office of Hazard Identification and Reduction, which was where I was the Children's Hazards Team Leader, which means I was the person who read the reports that came in of somebody getting hurt or killed by a consumer product. But for this particular hazard pattern, being a data-driven agency, we relied very heavily on and were influenced by Dr. Toby Litovitz at the National Capital Poison Control Center. She published and lobbied us with the articles that she had published about the incidents occurring with coin cell batteries as early as the 2028, 29. Around 2010, we were looking at this here at the agency, and one of my electrical engineers, Douglas Lee, was putting coin cell batteries between layers of baloney in our laboratory and watching what happened, because we didn't really understand this injury mechanism. What's happening if it's a piece of baloney or if it's in your esophagus is that the current that's in the coin cell battery is producing hydroxide with the fluids that are surrounding it. And that hydroxide's then damaging the tissues around it. And those incidents that we cite in the warning labels now, in as little as 2 hours, were the incidents I was reading as Children's Hazards Team Lead. And they're horrific stories where someone is misdiagnosed as having either swallowed a coin, or perhaps they think that they have croup or a cough, as has happened with Reese. and they're sent home. And that misdiagnosis made this really an insidious kind of what we call here a hidden hazard. It's hidden to the parents. It's hidden to caregivers. It's hidden to teachers at school. It's hidden to everyone, including the people in the emergency department who think the kid's got a cough. And hazards like that are the ones that are the hardest to control because the misdiagnosis and the red herrings that you do trying to figure out what's wrong with the poor child leads you to make mistakes, and they can be deadly mistakes. So if you follow human factors engineering, like I did as Children's Hazard Team Lead, the best thing to do is eliminate a hazard. If you can get rid of a hazard, that's the way you want to go, rather than guarding against it or just giving people warnings about it. So we worked at what is it about these coin cells that is producing the hydroxide, and with collaboration and help from industry, they narrowed down that it's coming from the steel that's made, that the battery's made of itself. And specifically, there are some things that you can do with steel to make it less likely to produce hydroxide. And after tremendous Herculean efforts, the solutions that they came up with really just were not really feasible. You couldn't come up with a steel that was both good for batteries and good for decreasing hydroxide production. Eventually, there would be some microscopic flaws in the steel, and it would still produce hydroxide. So it was a great effort, but they were unable to actually create a feasible battery that wouldn't produce this hazard. So if you can't eliminate the hazard using different materials, maybe you can prevent it from being swallowed, and you just go for a guard. And we came up with all kinds of ideas for expanding arms or switches or pressure activated buttons on top of batteries to see if that would be something that would prevent the current from flowing if it was ingested. And all of those things would work. The problem is they're not backwards compatible with billions of products in the world today that need batteries. And so from a cost-effective standpoint, it just doesn't make sense to make batteries that only work in new products. And you think of all of the industries that use batteries, and all the many batteries that are in the world today, getting a single standard for them is it would take a tremendous amount of work, and the cost benefit analysis doesn't work out for us. And we're required to look at the cost benefit analysis. So the problem is that if you have some button, then you have to have the device able to depress the button. And there are lots of places that people put the contacts inside the electronics for making contact with the battery. The way batteries are made now, you can make contact in any number of places around on the surface of the battery. If you restrict that, all of a sudden you make the batteries less useful. So we went that route too, and not having a way to eliminate or to effectively guard against it, we had to go to protecting the batteries from access. Children can't access them now. And so it became imperative to have the batteries stay where they belong, inside the devices or inside the packaging they're shipped in. And then the second strategy is to make sure that everybody knows when that battery is outside of a device is potentially deadly. And so public education became paramount. And that's where we are now in today's world. We're trying to control batteries in packaging and in devices and warn people so that whenever you're holding a battery now, a coin cell battery, top of mind is that this could kill somebody. And you control that battery and don't just leave it carelessly lying about where children can get to it. So that public education, it's incredibly important. I see there someone's invented inherently safe by inserting a fuse. Yeah, the fuse idea is a great idea. The problem is that it decreases the capacity of the battery. And so the cost benefit analysis has to take into account the efficiency of the battery. And then if it's got a slightly less volume inside of it, it has slightly less capacity. It will last slightly less long, and the lifespan is decreased. So the industry has to do that cost benefit analysis. If I were king, maybe things would be different, but the capacity is not decreased. Well, that's challenging. You should get a patent on that. Because if you can pass that cost benefit analysis, you can make a good argument that a regulation requiring the use of a new invention like that, yeah, you can make it a requirement for everybody to use a battery like that. If that's the case, then the cost benefit analysis works out pretty well. But anyway, where we're at right now currently is to make sure that everybody knows about this hazard and that the battery is being controlled by users of coin cell batteries across the country. And that public education is super important, and everybody in this webinar can help with that. Maybe we should return to the Q&As later. Those are some in-depth questions. Does cost-benefit analysis take into consideration ongoing publication and healthy lives lost around the world? Yes, the cost-benefit analysis has to take into account injury rates, the cost of them, the average cost of the hospitalization, et cetera, and the cost to society, even of loss of life and loss of, work hours, et cetera. So that the injury cost model that we use is published on our website. You can read more about that cost-benefit analysis. It's an inescapable requirement. The government makes the agency do a cost-benefit analysis for every regulation. So yeah, we can talk about that a great deal. So I think I could just stop talking there, Gary. We could go to some questions.
Thank you, Jonathan, and thank all three of you for your perspectives on this issue. I'm going to kind of throw it back out with a very general question. I have some specific questions for each of you, and hopefully we'll also have some more in the chat. Now that we have Reese's Law, and now that we've had comments from all three of you, I'm going to circle back and just say, what's next? Where are each of you working to try to move this topic forward from where we are? We've clearly achieved a lot through Reese's Law and through more awareness, but what are the next steps? And just I'll go to you and see if you could help us with that.
Next steps clearly for me are education, until we do get to that safe battery. And I think the future is bright. I think that God promises to use all things for good, and I've seen it firsthand. And I know that we're going to get there one day. But in the meantime, we've got to continue to educate. People have to know that there's a problem. Energizer came out with a new battery that has a blue dye. And I think it's important for medical professionals to know that if a child comes into the ER and they have some crazy symptoms and a blue mouth, they might have ingested a battery. Because if our medical professionals do not know that this battery exists, that this blue dye is on this battery, then they're not going to know that that's possible ingestion. So that's kind of part of the education that needs to be out there moving forward. Great idea on Energizer's part, and I applaud them for their efforts and putting the bitter coating and putting the blue dye on there to help, notify us that a child could have possibly ingested a battery. So that's part of the education, but education for parents, education on the honey. And this is what our medical professionals need to be telling our parents and caregivers when we do have children of that age in front of them, is what to do if it happens. Because again, if the parents don't know, they're not going to do it. For us, had we known that was a possibility, you can bet your honey I would have been asking for an x-ray, but I didn't know. Instead, I took the steroid, so that education is extremely important until we do get to that safe battery. So next steps for me is education until we do get to the safe battery.
Thank you, Trista. Chris, any comments on that?
Sure. I think from my perspective, there's multiple things, in the future of continuing to advocate for safety with these button battery injuries. And I think one is ways that we can continue to optimize the medical management protocols. We know that there's opportunity for improvement with timely administration of honey and consistency of volumes of 0.25% acetic acid irrigation, for example, in the OR, and ways that we can continue to improve those mitigation strategies to reduce progression of injury either before or after the battery is removed. And one of the things I didn't mention earlier is that liquefactive necrosis that's caused by a highly alkaline substrate in the esophagus actually continues to break that tissue down for days to weeks after it's removed. And so that's sort of the thought behind, doing these types of mitigation strategies. I think, you know, early detection is really important. And, one of the things that we were fortunate enough to get a grant from the Reese's Purpose Foundation to help support is just development of a screening tool for coins and batteries in the esophagus, which we've been working on at Nationwide Children's in Ohio State for several years now, using novel technology to be able to detect these batteries in the esophagus at an earlier stage, when an ingestion is unknown and a child presents with nonspecific cold-like symptoms is, another opportunity to save a lot of lives. And, look forward to further clinical testing in ways that we can continue to try to bring that forward for medical professionals to use in those urgent cares, EDs, and pediatricians' offices that many kids come in with nonspecific symptoms. Um, and then I think obviously the concept of just having that safe battery is what we hope to strive for. When industry is able to find that right solution. And Dr. Dickers, who's on the panelists, I mean, amongst the audience today, has his team has developed a novel technology that is a fused battery that is under development, and there's two other technologies that are being developed around the world as well. And just fully support one or all three technologies, anything that can get to the market, frankly, to help save kids. So.
Hey, Chris, as long as we've got you, do you want to make a comment about, the issue that often comes up about giving honey to really young kids and infant botulism and kind of weighing that versus button battery damage, which is so immediate and obviously potentially so life-threatening. Any thoughts on that?
Sure. So obviously the AAP has always recommended not giving honey under the age of 12 months, and one of the reasons we explored other medicinal options such as the sucralfate is we found that it was actually equivalent to honey as far as efficacy. It's just a hospital-based solution. It's also cherry flavored and palatable like honey, in the sense that a child could swallow it, and it can help reduce the rate of injury as a weakly acidic solution that's commercially available and FDA approved for other purposes, but while we're using it off label, can slow the rate of injury. So that can be used under the age of 12 months, in the hospital setting. Obviously, people don't have that in their kitchen. But the risk of having infant botulism from honey when it's domestically sourced is extremely no, extremely low. And in fact, there are countries out there. This actually happens frequently in Canada, where patients have to be transferred from far away and sometimes have longer distances, and they've actually used honey under 12 months of age, just looking at sort of the risk benefit, knowing that rate is extremely low. And so I think, taking every patient's sort of individual clinical scenario into account, and to, the risk of injury of the battery being lodged in the esophagus, and potentially the duration that it's going to be there before it can be removed in different scenarios. Some kids have to travel hours to get to a pediatric center. So I think just weighing all those things, is important for the management of every child.
And Jonathan, any thoughts on my initial question about next steps?
Obviously innovation that could eliminate the hazard would be the most preferred solution. But if you can't do that, we'll guard against it and publicly educate. That's really the least effective, but super important, because people need to understand this hazard pattern and guard those batteries. Yeah, and I failed to mention earlier, even a battery that's completely discharged and won't operate your devices anymore can still produce this hazard. It doesn't take a lot of charge, and there's always a little residual charge in an old spent battery. So there literally are millions of products out there using these batteries, and there are more and more every year because people like, smaller and cooler looking devices. So button batteries are not going away. People are using them.
And that's a recommendation of putting tape around a spent battery for the reason you point out, which is very important. We have some questions coming in the chat. Before we get to those, I do have a question I've been dying to ask Trista. And Trista, you've obviously accomplished a great deal by working in Washington and getting a law passed. This is not a common feat that's accomplished. I would really like to hear about what advice you would give others who are trying to advocate for, let's just say, consumer product safety, but it could apply to other things, but consumer product safety at the national level. And may give examples of things that you did that didn't work. Um, and things that did work, and just kind of give some advice of where people should start and things that you wish you'd known starting out on this.
Well, first I'm going to say call me. Um, One thing that I I learned was I didn't have anybody to help me, so I was just kind of out there on my own, and I was blessed. The first person I talked to was actually Jonathan Midget. Um, and praise the Lord for it, y'all. Um, God put the right people in my path, and I wouldn't be where I'm at if it weren't for that. Jonathan was very early on, Chris was very early on. I was guided appropriately, and I will always be happy to be that person for someone else because I had that. And there's people I walk that with every day. Reese's purpose started out as, the purpose for her, but that journey's also changed. I want to help other parents empower themselves and have that voice as well. So if you're on that journey, I'm happy to give that guidance and introduce you to the right people that I've already had the pleasure of meeting. I can't say that I really have done I did anything wrong. I got very lucky and I stayed in my lane, and probably because of the people that guided me. I have seen others though. And so I guess my advice would be know your lane, stay in your lane, know when to not step out, be respectful, be kind, but also don't back down. My daughter's life mattered, and I fought hell and high water for that. I did not give up, and I did do it timely, and I don't apologize for that. I can say that I probably irritated a lot of people along the way, but those are the same people that anytime I walk into the room will love my neck, and they're so happy to see me every single time and have a lot of respect for everything that I did. I think with every person that has passion, there's purpose behind it. And that is something that can be respected, especially when there is safety and a child's life behind it.
All right. Well, Reese's Purpose, you can go to their website, and Trista's giving an invitation to talk to her about it. I can't emphasize enough that things change because people get involved, and it isn't easy to take that first step. But when you take the first step and you do have people like Jonathan, like Chris, like Trista helping you, take advantage of it because that's how you're going to make change. I've got a number of questions, some of them just data driven. One that I'm going to combine two questions. One, and by the way, we can see the questions that are coming in, the panelists can, but apparently the folks in the audience can't. So that's what I've been told. One of the questions is how common are button battery ingestions? And another one regarding data has to do with are these ingestions because batteries have been left out, or because kids are able to pop open devices and are accessing the batteries that way? Does anyone have any data on that? Any thoughts, any comments?
I'll take a few things there. And I'll let Chris back me up on this one. A button battery is ingested every 75 minutes in the US. Um, on that, Reese got the battery from a remote that the battery was not secure. Children are rough and tough. They throw stuff. They have all kinds of things. She dropped that remote. It fell out. One common misconception, and guys, I hear it all the time, is, well, you should have been watching your kid better. Well, you know what? I'm a helicopter parent, quite frankly. All of my friends will tell you this is terrifying because if it can happen to you, we're all in big trouble. I am that mom, and it did happen to me. It takes 2 seconds. That's it. It takes 2 stinking seconds. She dropped the remote, she picked the battery up, and she stuck it in her mouth. That's why we need all devices with batteries to be secured. So that's part of how they get ingested. The other ones is from the junk drawer. People don't realize that they open those floppy cardboard backs, throw them in the junk drawer. They can get them from there. They also, and this was touched on earlier, um, when a product stops working and that battery comes out and people pull it out, just because the product does not work does not mean there's not still charge in that battery. That's why we talked about the tape. It can still burn a hole in your child. You've got to tape it up and dispose of it appropriately. And before I forget, I've thought about this 4 different times and have not spoke about it while I'm on here. For the medical professionals out there, you guys have got to report. I had so much stinking trouble in my advocacy trying to get this done. The data is not there for us parents. And I'm not just talking button batteries. You guys use this in everything that you do. When you have a parent that comes in like me that wants change, that wants to do something, if we do not have the reporting, if we do not have the numbers that we need to go and fight our butts off for our kids, it makes it 10 times harder for us. And you try and go and tell a congressman and a senator, hey, we need this change. But oh, I can only give you these approximate numbers. It's really hard and it takes a really feisty turd to get them to listen. But you guys, y'all can make that change. Y'all can make that difference by taking the time to go and report the incidents. Y'all can help us so much. You guys on the front lines can make that difference yourselves. And then past that, y'all can be little bad booties right there yourself by stepping outside of those 4 walls and being advocates too. Y'all don't just have to be the doctors. You can step outside those doors, go up to DC, tell them what you're seeing, tell the injuries, tell them the changes. Y'all are seeing the injuries firsthand, even more so than us parents. And quite frankly, the doctors of Reese's cried with me. They're still my best friends. Y'all get so involved with us and the injuries that y'all see. Those babies become your own. Y'all can advocate just as much and just as well as us parents can. And maybe you just might have the parent like me that will do it by your side. Y'all can go be the change just as much as we can, and probably just as good. So don't forget that even though y'all might have all those letters behind your name, you can put advocate behind it too. And y'all can go out there and truly change the world and make things better just from what you see.
So I think we can stop the webinar now if we wanted to, because that message was so important to everybody. I've been in the field. I'm just going to take a minute because I have to respond to this. I've been doing this for over 40 years, and what I've heard so many times is that, if the parent was just watching their child more closely, if they weren't, if they were more attentive. And what I remind people is, we learned 150 plus years ago with other public health problems, when we had infectious diseases spread through water, we didn't blame parents when they didn't boil their water each time and their child got sick. We didn't blame the parent. We designed the problem out of existence. We figured out, we had sewer treatment plants, we had potable water systems. We focused on the cause. And so when you have someone who's injured, whether it's a button battery or whatever, it isn't the parent that caused the injury. It was the electrical current in the esophagus that did, and we have to focus on that, the cause. That is how we're going to achieve injury prevention, just like we've been so successful with infectious diseases. So we got to stop the parent bashing. We got to stop the blame, guilt, and fault. And consumer misuse and all these other things that we hear all the time, and focus on how we can change, design the problem out of existence. So thank you, Trista, for bringing that out. And Jonathan put something in the chat. I don't know if everyone can see it, but Trista brought up another really important point, and that is that reporting these incidents is important, because then we have the data that we can refer back to, and may even be the first notification of an emerging hazard that then can be responded to either by the Consumer Product Safety Commission or other groups. And that's saferproducts.gov. So go to that website. If you have, an incident regarding a consumer product, report it. there, and the Consumer Product Safety Commission monitors that. It's also openly available to the public. So you, as a consumer, can go onto that website and see, oh, I had no idea the injuries were occurring with this product. And look at all of these. You can become an informed consumer by using that website. So thank you both for sharing that. Now I probably lost track of where the questions are. Any Someone put in here, I just love it. Mic drop Trista. So I think people agree. While I'm doing this, any other comments anyone wants to make regarding that as I look up these questions in
There
the
was there
Yeah,
was one.
Gary,
Oh,
go
go ahead.
ahead.
I was going to say there was one question. We're not talking about the double A's and triple A's. We're talking about the coin-shaped, button-shaped small batteries. And there's nothing in particularly special about them that makes them attractive to children. That was another question. That's just kids stuff things in their mouth, and that's what happens. Go ahead, Chris.
Thanks, John. I think one thing to kind of elaborate a little bit more on the reporting issue, and I think Trista brought up the importance of that data that we need to drive change as well. And when we looked at a survey we did of over 400 medical professionals who are endoscopists and surgeons who actually remove foreign bodies from kids, we actually found the foreign body reporting rate for over 400, surgeons and endoscopists who manage these kids and can attest to the complications that they have and the presentations they had and how easy it was to remove the foreign bodies. 4% of those actually get reported to a data source. We found
Ouch.
for button batteries, 11% of them were actually reported to a data source. And so this is alarming to us that such poor reporting existed. And I think, obviously the saferproducts.gov is a good option for consumer products. And we actually started a nonprofit for this purpose called the Global Injury Research Collaborative. And it's essentially funds just a smartphone app for medical professionals only to report injuries and instances of foreign body ingestions. And one of the novel things we have in the app is the ability to take a picture of the foreign body after it's removed from the child and additional follow-up details as well. It only takes 2 minutes to report a ingestion case. So
That's just a stunning finding that 4% or 11% are reported because we are a data-driven agency. The more cases we have, the more able we are to make a case for some action, the more able we are to convince the commissioners to put it on a priorities list. So, it really does take a village or a nation of pediatricians to report these things. Tell us what you're seeing. Saferproducts.gov. Don't forget.
yeah, I guess just to add to that, Jonathan, there's a question in the chat about the IC10 diagnosis codes. That's something we worked actually for over a year on in collaboration with the AAP coding committee. And we were able to actually get foreign body specific diagnosis codes approved in the ICD-10 system. So these are secondary codes. They can't be used as a primary diagnosis code, but if foreign bodies are removed or if a child's admitted with a foreign body related injury, just adding a secondary code, for a button cell battery or there's jewelry and glass and pins and other types of objects that we see kids ingest or aspirate. That data is also mineable for incidents and it does depend though on people actually using those codes. So I think it's just really important to think about that when you have a child who's injured by any kind of foreign body ingestion or aspiration event.
And Chris, do you want to say anything about the Global Injury Research Collaborative? Are
So
you related to that? Go ahead.
yes, yeah. So I helped start that actually just purely because, in talking with members of industry, they just kept wanting to see data. And then they got to the point where they said, well, it's not our batteries that are harming these kids, it's somebody else's batteries, and we don't have this problem. And so I don't know how more definitive you can get than having a picture of their battery and sharing it. And so I think that's where medical professionals who actually remove these, I know many of you that are or in the audience today may not be endoscopists or surgeons that actually remove them, but I think it's just ways that we can collect that novel data that doesn't exist through any other mechanism around the world, and follow-up's actually really important too. And this is how we're going to actually advance medical protocols for how we manage these children. There's a lot of unknowns still after we take out the battery. What do we do? When do we feed a child? When do we get an esophagram? When do we get a CT or MRI to look for, proximity to the aorta? And these are all things that are done variably at every center because nobody has any data to actually drive that change. And so we basically create through donations just a free smartphone app for currently available on the iOS App Store for medical professionals to basically register and download and can submit cases of foreign body ingestions. And our hope is that over 10 years we can collect some novel data that can drive change through this centralized global database. So
Thanks. So I have just a general question for all of you, and that is, a lot of the way things work in this country is that we wait until the injury occurs, then we say, whoops, we didn't know that could happen, and then we try to respond to it. And I always talk about how unfortunately our kids are like canaries in the coal mine. We're reactive to a problem. How can we better protect not only kids but consumers in general from keeping unsafe products from getting onto the market in the first place? And this is probably a Jonathan question in some ways, but I think all of you probably have thoughts on this since you're so involved with this topic and in this field. Any comments on that?
I would say that industry consensus standards, often called voluntary standards, are a field of volunteerism that is underutilized in this country. Consumers are allowed to be on standards committees. They're allowed to have a vote just like any industry member in the room. And it can take a little time, but having consumers in the room increases the quality of the discussion that's happening about safety. And so, one of the best ways to increase safety in an entire industry is by influencing the voluntary standard at ASTM or UL or NFPA. You name it, the product category's got some standard for it. And so if we could get more consumers participating in voluntary standards, we could influence the discussion.
And I'll be happy to say if anybody wants to get involved with, I'm active with ASTM. If anybody has questions, and with UL as well, if anybody wants to get involved with either of those, I'll be happy to be a sounding board for questions or get you in contact with the right people. When Jonathan says that consumers can get involved, not only can they, we need consumers. We need more voices like mine desperately, because the people sitting in that room, we have the manufacturers, we have the business owners. We need the voices like me, the moms, the parents, the caregivers that are like, wait a minute. We need more people like us. Please get involved. And it's really kind of fun to be a part of child safety. It's fun to be a part of being on the right side of it and knowing that you're protecting people, and you see the stories and you see the injuries and you're like, well, this has got to change. And it feels good to be on the right side of it. It's a good thing that you do. It's a good thing to volunteer. It's good to be a part of the good side. So please feel free to reach out to me on that. I'm happy to give guidance there if anybody feels called to do so.
I'm willing to bet that a lot of people don't know what the acronyms ASTM, of course, they just go by that now, and UL are, and they probably don't understand the difference between voluntary standards, product safety standards, and mandatory standards or rules or regulations. One of you want to maybe explain that to our group and
Sure.
sort of the interaction between them?
Sure. The US government saves a lot of money by allowing industries to volunteer a standard. And this is like the industry making its own standard before the government has to step in and do that. So a mandatory regulation formulated by the US government under the Administrative Procedures Act takes a long time, a lot of public comment, a lot of expense, and it's your tax dollars being used to do that effort. So it just makes sense to defer to voluntary standards. And in fact, the Consumer Product Safety Act requires my agency to use a voluntary standard if it's available. So it's just a cost saving device, and it's allowing the experts to get together and basically regulate themselves rather than making the government do it. That's the difference between a voluntary standard and a mandatory regulation. The voluntary standard was volunteered by the people making the product.
And as Trista mentioned, if you want to get involved, you can become a member. You can attend these meetings and participate in the discussions, and often form your own sort of subgroups, make recommendations, and then lobby for those to get passed and become part of the voluntary standard. So very important. We have about we have about 4 minutes left. And I think there have been some questions about having contact information from all of you. So if you're fine with that, we'll maybe have Laura put that in the chat while we're finishing up the last 4 minutes. But I'm going to give each of you just a couple of minutes to sort of wrap things up before we finish. And Trista, I'll start out with you.
Yes, there was one over here that was talking about sharing safety stuff with her staff, and I've had a few emails since we've been in here. If anybody wants to contact me, please feel free to reach out. I'll be happy to hop on a call with you one-on-one. I'm happy to speak with lots of different hospitals one-on-one, whether it's Zoom or going to visit, doing messages with your daycares, whatever it is. I like to get people set on fire for child safety when it comes to reporting, when it comes to your medical daycares, whatever it is. I'm happy to get people to the right spot and to get excited about the things that are important. So please reach out. I'm a phone call away always. My number is not that hard to find. Open book as always. So please reach out, and I'm sure they can get my information to you. And thank everyone for attending today and having me.
Thank you, Trista. Chris?
Sure. I'm also happy to talk with any of you if you want to drop me an email and let me know of any ideas. We're all here to work toward the common mission of, how do we prevent these child injuries from occurring and save kids from ED visits and surgeries and life-changing and life-altering and life-threatening situations. I think that persistence is really important. I think, look for what you're passionate about and look for opportunities when you see patients that are harmed in some sort of manner, in the hospital, and ways that, you could help prevent those and the next child from having that type of injury. So I applaud all of you for the interest that you have in advocacy and injury prevention. And, I wish you the best of luck. And, I think we're all kind of part of the same team and look forward to what else we can accomplish together.
Thank you, Chris. And Jonathan?
Yeah, I would say get the message out to people so that they know when they've got a coin cell battery, they pay attention to it as being an imminent hazard for children. And, also don't forget saferproducts.gov. If you come across one of these injuries, the agency wants to hear about it, and that's the best way to share your incident report with us, saferproducts.gov. And also ask your peers if someone presents with blue dye around their lips, what does that mean? You might be surprised how many of them won't know what that means.
And thank you, Jonathan. There's been a number of questions regarding other types of products in the chat. And unfortunately, because of the limited time, we can't talk about those today. But what that tells me is that this webinar has been really effective. It's gotten you thinking about how can I apply the lessons from this topic to other topics that are clearly issues for child safety. So please reach out to our panelists. I'm also available if you want to reach out to me to help give you guidance and support. And I'll just sort of end with just one comment, and that is that over the years, I've seen things change, and it's not uncommon for there to have been just one person to have sort of ignited the spark, provided the spark that led to formations of coalitions and group activity that led to that change. And so one person, just one, can make a difference. And so I'm going to encourage you all to take that as maybe a going home lesson, and to take it, advantage of all the gifts that you have and the resources that you have access to help make this a safer world for kids. So with that, I'm going to thank our panelists. Trista, thank you so much for being here today and sharing your story. And your organization is doing such important work. And I know now that you're branching out into other areas of child safety. So fantastic. Thank you so much for that. Chris, I've known you for years. You're doing amazing research, and thank you for all your leadership in everything you've done. And Jonathan, same thing. I've known you for years, and everything from your engineering expertise to your fantastic public relations and ombudsman role. You're an amazing leader, and thank you for that. I also want to thank the T4CIP group for organizing this webinar throughout the day today. It's their day of action. They'll be doing local activities in their institutions, their communities, to help promote awareness of this issue. And they'll be also doing that in future years and other topics as well. I also want to thank the folks, Laura Datner, Katrina Boylan, and Tracy Meehan in particular, for helping behind the scenes to organize this. Really appreciate it. And also thank our partners at the American Academy of Pediatrics that help co-sponsor the T4CIP program, for their support as well. We have now come to the end of our time. Thank you all for attending. This program is recorded, so you can find us. We'll send out an email with the link. So thank you, everyone.